Alright, so we'll start with supine leg length to determine Nathan's leg length. Here, I'm going to have you push out. Indicators. 1, 2, 3. Get back in. Check the medium and low. And Nathan has a left short leg. So now we're going to move on to the arm facet test. Hand up here, soft fist, and hold. So we're testing for strong muscle. Are you good now? Alright, so what I want you to do is place this hand at your belly button down to your bone. Okay, from ASIS. The 4-finger contact, flat 4-finger contact. Hold. Alright, strong. And hold. Good, strong. So now in clockwise fashion, you put this down. I'm going to go over this side. Same thing, make sure the muscle's strong, so make soft fist. Hold. Okay, good. Now place that here. There you go. So ASIS, 4-finger contact. Okay, hold. Strong. And hold. So he's strong in all 4 facets. What we would do if he was weak, say, well, he had a left short leg. Just say the upper facet weak, that'd be a UMS. So upper facet weakness, medial knee pain. So we should have medial knee pain there, and then a short leg. Oh yeah, now we're gonna block him. Nathan, stand up. Alright, so we're gonna set this up. And Nathan, have you lay down. Front, face down. Just kidding, supine. Okay, so he's supine. This is active blocking. Maximum treatment time is 2 minutes. The goal is to balance the body. Well, balance all 4 facets, so re-strengthen the weak facet. Alright, so I'm going to have you lift your hip up for me, so it's active blocking. 45 degrees superior to the greater trochanter. With Nathan, we said that he had a UMS, so upper facet was weak. We checked on this side. This was his short leg side. Upper facet was weak. He had medial knee pain, and this was also the short leg. If this was his long leg, or the flip side, there's LLL, which is long leg, so this would be the long leg, lateral knee pain, and the left lower facet would have been indicated, but it would have been weak for that. But anyway, we're going to proceed with Nathan having the UMS on the left side. So his upper facet went weak. So we had him on blocks to strengthen the facets. Now we're going to check, see if it's strengthened. If not, we're going to get into block augmentation. Alright, so put your hand on your belly button for me. Okay, so, okay. Okay, so he's still weak, it didn't strengthen, so we're going to go into block augmentation. So first thing we'll do is we're going to jiggle the blocks. Okay, and now we're going to check. Oh. So he's still weak. So then what we would do is we would pump above the knee and the thighs about right here. So okay, we check, go back. Awesome. It's still weak. So from there, because this block here, we're gonna have our hand here, opposite hand here, and we're gonna pump 3 times, 4 times. Check that facet again. And it's still weak. So then this is when we would proceed to was cranial basic 2. So with Nathan here, to begin this, we're going to have muscle test. I'm going to have you take a deep breath and hold it. So, alright, so now take a deep breath and hold it. So he's strong. So if he wasn't strong, what I would have you do is exhale. I would test it. Okay. If he was still weak or whatnot. You check inspiration, expiration, but he went strong on inspiration. So it is a expiration assist fault or expiration fault. So the muscle test strengthen on inspiration, so it's an expiratory or expiration assist fault. So what you're gonna have when we start doing is get Nathan in the breathing pattern. So when you inhale, I'm gonna have you place the tongue on the roof of your mouth and press up. At the same time you're doing that, you're gonna bring your feet towards you, so you're gonna dorsiflex your feet. Okay, and then when you exhale, you're gonna take your tongue off the roof of your mouth and plantar flex your feet. Because this is an expiration assist vault, I'm gonna apply an I to S or an S to I pressure with one hand on his forehead and one hand on his occiput while he does that breathing pattern. So on the occiput here, so I'm gonna have you breathe in. So just have him get this one down, breathe in, put your tongue on the roof of your mouth, dorsiflex, now exhale. Okay, so now we're gonna do it all together. So, alright, breathe in. Alright, now I'm applying I to S or S to I pressure. Breathe out. Okay. Breathe in. Yeah. And that's how we would do to correct the expiration assist fault.
You do opposite, so if there's an inhalation problem, you fix on the exhalation.
Post block technique. This was Kelsey's short leg. So we begin by breathing lateral, up, medial, down, down. And we do this 3 times. So that's with the short leg. And then we would go to the long leg. And from here, we'll go up, medial, lateral, down, medial, lateral, down, medial, lateral, down. So do that short leg first, then long leg, and then we proceed to sacral cup. So, hold it for me. So, here, we're gonna have you lift up this leg, Kelsey, extension, and we're gonna test it. Okay, so it's weak. So there we go in TL. So S2, S1, just lateral to that. So this is for S2, S1, pull it up. All right, now test. All right, she's still weak, so we're gonna come down to S3, S4, and TL. She's strong, so from here, we would do a double thumb toggle over the S3, S4 area, or you could do a pressure, so you could do toggle, or you could apply pressure. And then from there, we would proceed to trap fiber analysis. So for trap fiber analysis, the doctor's seated at the head of the table, patient's lying prone. You label areas 1 through 7. 1 is going to be at the V of the shoulder. And then you'll have 7, which is off the T1 transverse process. 7's here, V1's here. And then you're going to label 4, which is in between this arc. And then from here, between 1 and 4, you'll have 2 and 3, which are a thumb space apart. And then 5 and 6 between 4 and 7, which is thumb space apart. So what you'll do is you'll exert pressure on each of those points. So 1, 2, 3, 4, 5, 6, and 7. And you'll do this on the other side and compare. What you're looking for is the most tender spot. So, and from there, from the most tender spot, you'll correlate those with the cervical, thoracic, or lumbar, and the most tender there, and you'll do adjustment. So the adjustment for cervical spine would be the figure 8. The adjustment in the lumbar and thoracic will be at the spinous, and mostly I to S, P to A thrust over the tender spinous.